The Newborn Intensive Care Unit, or NICU, at Baptist Women's Hospital is a first home for more than 600 babies a year. Most of these infants are born prematurely and need a lot of special attention to develop properly. But that attention doesn't end once they're discharged from the NICU. Once again, here's Lorene Cachola with a look at a preemie workout that's working wonders.
Sit-ups, weight training, sensory exercises. Whew, what a regimen for little Mary Brooks Winchester. And she's not even 6 months old yet. For her mother, Linda, the thought of Mary Brooks accomplishing so much in such a short amount of time was the furthest thought from her mind when she gave birth a month earlier than expected.
Well, when I first saw her in the NICU, and saw her skin and how translucent it was, and saw all the needles and, these teeny tiny little feet, I was so concerned that she was going to be delayed in many areas.
The hard-working healthcare workers in the NICU got Mary Brooks fit for discharge, but the challenge for Mom and Dad was getting their little bundle of joy caught up to her chronological age.
Oh, and there's Mary Brooks. See, she's growing up so big.
Here at Baptist Rehabilitation Germantown, parents get that much-needed assist.
We see them at 1 month adjusted age, which is 1 month past their due date. You start out with observation and then you do small movements to the child and interventions and see what their reaction is to that and see if they react like a 1 month-old baby would.
When the physical therapist came and it was one-on-one with her, I was amazed. And I was also so amazed at how well educated she was and how professional she was with the baby.
It may look like fun and games.
There's that smile.
But there's some serious work going on here.
You'll lay that infant on the mat and you'll look at how they move. Are they being able to bring their hands in toward their face? We'll do visual tracking. We'll watch how they're able to track a toy to one direction or to another. We'll check for their muscle tone, reflexes, those type of things. If I lay it there on her chest at this age, she should be reaching in and grabbing the rattle with her hands and like bringing it to her mouth. And she goes, "Let me demonstrate." Yeah.
Good girl.
Very good.
An A+ for that maneuver. But not every effort makes the grade.
When she's on her belly, she wants to roll over immediately.
Children should absolutely sleep on their back, but that means that when they're awake and they're happy, they need to be on tummy for head and neck control.
Speaking of head control, that's another area of concern with Mary Brooks' development.
She tends to lean her head to the right, so we have to pull the body to the right to tighten the left muscles.
And Mary Brooks isn't the only one with a workload.
I didn't expect homework. No, I thought, they'd take care of it there. But, when we did realize that, we have things to do once we got home, we realized this is really serious. We have to maintain so she will continue to grow and develop in the positive ways. As a mom, your baby is the center of your life. You do anything for that child. And knowing that you're going to a physical therapy session and she is getting that one-on-one attention and they are focusing only on her and her exact needs and giving you homework so you can make sure to fulfill everything that she needs developmentally, it's huge.
Mary Brooks may have come into this world earlier than expected, but her therapy team is determined to get her development back on schedule.
She's going to come up to her chronological age, and that's our main goal. There's no crystal ball with any child. You can't say that they're going to be down the line a C student or A student or whatever, but I think she's going to do well. Potential A student, absolutely.
Oh, good girl.
For Smart Medicine, I'm Lorene Cachola.